South Florida today on NBC6 HD.
Nathalie, thank you so much. And as Nathalie just mentioned, October is Breast Cancer Awareness Month. But did you know that this month, September, is Prostate Cancer Awareness Month? And did you also know that 1 in 6 men will be diagnosed with the disease this year? Dr. Maury Jayson is here today to tell us about a possible less invasive therapy procedure to treat prostate cancer. Welcome. It is so good to talk to you.
Thank you. Nice to be here.
How serious of a disease is this?
Well, it's an epidemic in terms of numbers. Again, 1 in 6 men in their lifetime will get prostate cancer, about 38,000 deaths per year, but 200,000 new diagnoses per year. So we're not killing a lot of men, but nonetheless, we are losing men. 38,000 is quite a lot.
Why aren't men doing the necessary screening, or do they, to prevent, this?
Well, a lot of men don't come in for screening because they're worried about, A, the screening process itself, which is painless and easy, and B, they're worried about the side effects of treatment. They're worried about becoming impotent, about leaking urine, and therefore they figure if I don't know, I don't have to be treated.
Well, unlike women with breast cancer, we get in there and get our mammos and everything.
Yeah, the women don't hesitate, and when they're told they have a problem, they take care of it on the spot. The men, a lot of times, stick their head in the sand because the treatment options until now have been somewhat limited, mostly by side effects and fear of those side effects.
Okay. You have a new treatment, though, that could take some of the fear out of all of this, right?
Absolutely. The treatment is called HIFU, which stands for High Intensity Focused Ultrasound. And it's an ultrasound-driven treatment, no radiation, no cutting, no surgery, and virtually none of the traditional side effects.
And let's put up some slides as we're talking here, folks, in the control room. What are we seeing right here?
That's the ultrasound probe, and you can see it emits ultrasound both to image the prostate as well as to treat the prostate. It indexes and moves through the prostate there, concentrating sound waves with laser-like precision to basically heat and destroy prostate cells.
Wow, you kind of said it kind of reminds you of this hotel in Vegas, the whole procedure.
Your story about the Vidara, where it concentrates the light waves into spots that are burning people's hair. In this case, we're concentrating sound waves into a pinpoint spot that gets extremely hot, approximately 200 degrees Fahrenheit, and it's literally vaporizing the prostate cancer cells.
Can you get it in this country now?
Currently, there are FDA trials underway as close as Naples, Florida, where trials are still ongoing, but our FDA has not yet approved it in this country. However, there are a number of centers that have been approved around the world, and patients are being actively treated in places as close as Nassau, Cancun, as well as Toronto and Niagara, Canada.
Side effects, recovery time, those kind of things?
Patients are up and out having dinner the same night, Trina. It's amazing.
Oh my goodness, that is amazing.
Yeah, very few side effects, very fast recovery time. They're literally back to work as soon as they get off the airplane.
Wow, that is pretty incredible. All right, if folks want to learn more about this and might not want to take the step to come into the office to see you yet, how can they do that?
Well, we're giving a free informational seminar in honor of Prostate Awareness Month. It's going to be on the 27th of this month, of October, at the Broward Specialty Surgical Center in Pembroke Pines. They can also go to the website at www.sfurology.com, and there's lots of information out there. They can call the office and speak to our nurse in a confidential, no obligation phone consultation.
And what's the danger for men who don't keep up with their prostate health?
Well, the big danger is that prostate cancer has no symptoms early on. By the time men start experiencing symptoms, oftentimes it's too late for us to treat them.
Amazing. Okay. And so this seminar is a place where they can ask questions as well.
They can ask questions. Occasionally some of our previous patients come in and have man-to-man conversations, but they can definitely ask questions. They can learn a lot about just screening and general prostate health, and we'll talk a little bit about these new minimally invasive treatments.
Well, this seems like revolutionary and really could take some of the fear out of this procedure and even the disease. When do you think we'll have it in the United States?
We're hoping within about a year it'll be available in the U.S.
And what does it take? Does it have to go through the trials and then all that material is turned into the FDA?
Correct. A lot of the trials are enrolling now. Some of them are full, and the data is maturing. They're following patients for several years to gather efficacy data, and then the FDA will review that information, and hopefully they'll approve it.
Who should be screened in the first place?
We start screening men at age 50 with a simple blood test and a simple physical examination, nothing painful, and men with higher risk, which would be African Americans and men with family history of prostate cancer, we start at age 40.
That young?
That young.
Why do African Americans have a higher propensity?
Don't know. We really, even when you factor in socioeconomic status, etc., we're seeing African Americans and even some Caribbean men in a higher risk category, probably something in the gene pool in their cultural history.
Interesting. Well, it's been fascinating talking to you. You know, thank you for bringing this information to us, because it's going to help a lot of men out there.
Yeah, we're excited. Thank you.
And hopefully a lot of folks will go to the seminar. For more information on the high-intensity focused ultrasound, you can visit Dr. Jayson at Westside Regional Medical Center at 8201 West Broward Boulevard in Plantation, or give a call at 954-473-6600. Also, remind us again exactly when the seminar is going to be.
October 27th, 7 p.m. at the Broward Specialty Surgical Center on Sheridan Street in Hollywood.
All right. Thank you so much.
Thank you.
Roxy, over to you in the kitchen.